Good morning, everyone. Good morning, good afternoon, good evening from wherever you are calling from. Thank you so much for joining this session today. We are really excited to have you all. I can still see many people coming in. I will just allow a bit, maybe 1 minute to allow people to come in. So thank you again for making time to join us for this exciting session. I'm excited on behalf of the Prevention Collaborative, UNICEF and Equimundo to welcome you for this important webinar. This is our launch of our fourth brief, which is in the series that we have, I think, presented before to this same team. If you're new to this, we have a parenting series called Parenting Programs to Reduce Violence Against Women and Children. And this is going to be our fourth brief that we're going to discuss in this morning. So my name is Lina Digolo. I work at the Prevention Collaborative, and I'll be facilitating this session today. I will introduce my speakers, exciting team of speakers shortly, and just introduce the session. But before we start, I would like us to quickly look at some housekeeping rules, just to remind ourselves on issues that will be really useful for us as we go through this webinar. Next slide, please. So please use the chat box. I can see people have already started using the chat box to introduce yourselves. Quick reminder that we are going to record this session, and it will be available in our website immediately. Immediately we are done with editing it, but you'll be able to find the link for those who would like to rewatch or to share it around. Introduce yourself, tell us where you're from, your name, and the organization you're representing. And if you have any questions as we go through the webinar, please feel free to use the Q&A box to just type in your questions, and we'll try our best to answer them in box or get them answered in plenary. Next slide, please. So we'll do this session in phases. The first group of speakers that I'm going to be introducing shortly are two speakers from the organizations that have spent a lot of time really working on these briefs. First speaker is Alessandra Guedes, who is the Gender and Development Manager at UNICEF Innocenti. Alessandra has spent a long time in her life really working on matters around VAW, VAC intersection, and she's been quite instrumental in this development in this fall series brief. So we're excited to hear from her and the work that she's been doing with UNICEF around this issue. We will also have Kate Doyle, who works as a Senior Associate at the Prevention Collaborative. Kate has been leading the writing and thinking toward about these briefs, and she'll be sharing all the work that we have put in around the fourth M&E brief, which we are sharing today. For those who came into the last webinar, we already had a good conversation around the last three briefs. So you'll be hearing from these two shortly. And just a brief introduction to this series for the purpose of those who've not heard of them, have not been there. We've had a series. This is a 4-part series. The first series was around why it is important, and why this mainly focusing on the significance of parenting programs in addressing both VAW and VAC. And then we have a second series which really looks at, so what does a gender transformative program look like, and details really how these are designed and the challenges that come around implementing this and successes. And then the third brief was really now getting really practical on how this could be adapted. So we welcome you to go to any of the sites, UNICEF, Prevention Collaborative, or Equimundo, and just find the other briefs. You can also find the webinar in our site to bring yourself up to speed. So for this particular session, we're really going to focus on the fourth, which is about how to measure change. And this is really going to bring together lessons from research, programs, and practice, and focus on how to strengthen our monitoring and evaluation for parenting program, especially those that are really trying to shift gender norms and reduce violence. We've gotten a lot of questions around this, so I'm sure everyone here, just looking at the attendance, is interested and keen to hearing from our speakers. So I will not hold you further from them. So welcome, Alessandra and Kate, and start off for this exciting session.
Thanks so much, Lina. Hi, everybody. Welcome. We're so pleased that you're joining today. I'm Alessandra Guedes, and I lead the work on violence against children and violence against women at UNICEF Innocenti, which is our Global Office of Research and Foresight. And it's really wonderful to see so many of you joining and to see all the names and the locations popping up in the chat. And I find it particularly inspiring that despite the many challenges that we're facing individually and collectively, we have over 800 colleagues who've registered for this webinar. Thank you for your dedication. We see you and we appreciate you. I would also like to offer a heartfelt thanks to our colleagues at Equimundo, the Prevention Collaborative, and colleagues across UNICEF for their collaboration. Together, we are generating and translating evidence to show that programs that support parents and caregivers offer a fundamental opportunity for us to promote gender equality. We really have an incredible lineup of speakers and panelists today, and I'm both grateful and excited to hear from each of them as we introduce this new guidance on monitoring and evaluating parenting programs. And before we learn more about the fourth brief, I wanted to focus on and reflect a little bit on the foundation of the series, which Lina mentioned, and why this work is so critical. You know, those of us who've been working in this field for a while know that historically, the work on violence against children and violence against women has taken place in isolation from each other. And the key contribution of Innocenti's work on violence prevention has been to show that violence against children, adolescents, and women intersect in multiple ways across the life course. For example, violent discipline of children and intimate partner violence against women often take place in the same household. And importantly, we know that when children witness violence against their moms, they can suffer the same negative consequences as if they had experienced violence directly. And I'm going to ask our colleagues to please share the infographic now on the screen. So earlier this year, Innocenti produced a new infographic which captures what we know about the overlap between violent discipline of children and intimate partner violence against women within families. For example, we know that exposure to violence early in life, directly or as a witness, is the strongest predictor for perpetrating or experiencing multiple forms of violence in adulthood. In other words, violence leads to more violence. And many of us are familiar with the staggering statistic that 1 in 3 women and 1 in 4 adolescent girls experience intimate partner violence in their lifetime. But I think fewer of us realize that 1 in 4 children globally live in a household where their mom is experiencing intimate partner violence. So it is our hope that this infographic will help clarify the intersections of these different forms of violence and will help us to advocate for policies and programs that reflect this evidence, including parenting programs that are intentionally designed to promote gender equality and reduce both forms of violence in the household. So as we begin today's discussion, I'm reminded of why we do this work. And in times when challenges can feel overwhelming, I think it's important for us to remember that progress happens because of committed individuals like all of you here today, practitioners, advocates, researchers, survivors that are working together across sectors and across disciplines. And with this in mind, it is now my absolute pleasure to introduce one of the most committed individuals that I've had the pleasure to work with, and that's Kate Doyle, who has been absolutely instrumental in the development of this series. Over to you, Kate.
Thank you so much, Alessandra, and thanks everyone for joining us today. Next slide, please. I'm just going to recap, but we're very excited today to be launching the 4th resource in this series, Parenting Programs to Reduce Violence Against Children and Women. And our 3 organizations, UNICEF, Prevention Collaborative, and Equimundo, came together really because we had these shared goals of preventing both types of violence. And we saw parenting programs really as a unique opportunity to reduce both types of violence. And we knew that there was increasing evidence that suggests that parenting programs can be strengthened to reduce both violence against children and violence against women. And those programs that do often take a gender transformative approach, meaning that they intentionally promote gender equality. They engage participants, both male and female caregivers, in challenging and questioning unequal gender norms and power dynamics that perpetuate violence. And they aim to strengthen both parenting and couple relations. We also knew that there was growing interest among practitioners on how to actually integrate gender and violence prevention into their existing parenting programs. And so this series was really designed to respond to that interest. Next slide, please. And as Lina mentioned, we've now already launched the first 3 resources last year, but the resources are really aimed at supporting parenting practitioners to adopt this gender transformative approach to prevent violence against children and violence against women in parenting programs. And they really deliver on the why, the what, and the how. So the first in the series is a summary of the evidence of why it's important to look at these intersections and why gender equality matters for parenting programs. And then the second really looks at what gender transformative programs look like. What's the common content, delivery, approaches that they use? And the third is really a step-by-step guide of how you can actually integrate gender and violence prevention within your existing parenting program. And today we're excited to launch the newest resource, the 4th in the series, on how to measure change. Next slide, please. So this one is really aimed at supporting parenting practitioners to effectively monitor and evaluate their programs after they've gone through this intentional process of integrating gender and violence prevention. So it focuses primarily on the aspects specific to gender and violence, which might be newer to parenting practitioners. It's not meant to be a comprehensive guide on how to monitor or evaluate programs. It really seeks to support those who have done this intentional process, or organizations and practitioners who are designing a parenting program from the start, but which aims to really promote gender equality and reduce both types of violence. And the guidance includes not only guidance, but a number of recommended resources and tools that practitioners can use to gather more information, to integrate into their research and evaluation. Next slide, please. And so we know that monitoring and evaluation are critical to successful program implementation. And by monitoring, we're talking about that systematic process of collecting, analyzing, and using information to track program implementation progress, but also to identify the emerging problems and potential risks that might come from our program. Whereas when we're talking about evaluation, we're talking about the systematic assessment of program impacts and processes of change. And in this guidance, we're referring to research-based evaluation. So thinking of more rigorous sort of standalone evaluations that are often led by or in collaboration with an external research firm. And we know that after you've adapted your program to integrate these gender and violence components, monitoring and evaluation is really critical to understand whether those program modifications are being implemented as intended. Are they feasible? Are they working? And if they're working or not, and for whom they might be working, and whether and how the program is achieving the expected outcomes for caregivers, children, and families. And this information is crucial not only for an individual program to understand implementation, but also to help us to build the broader evidence base around gender transformative parenting programs, to have more evidence to show the unique aspects of these programs and the benefits that they can bring. Next slide, please. And within the brief, I'm just going to give a bit of snapshot of what you can find. Some of what we include are key considerations, things that you should consider when you're planning to monitor and evaluate your adapted program. And these include remembering that monitoring is key. It's often part of the program implementation that is underfunded and underinvested in, but particularly after you've gone through this process of integrating these new approaches around gender and violence prevention, monitoring is really crucial and actually takes precedence over evaluation to understand whether or not the changes you've made are really feasible and are working. And if not, being able to gather data in a timely manner to be able to course correct or address those. And of course, you must consider gender in your approach. You need to understand for whom your program is working and not. You want to understand whether individuals have different experiences or benefit differently from the program depending on their sex or gender identity. You want to think about the different outcomes that you're seeking for male versus female caregivers. For example, you might be aiming to increase men's engagement in responsive care of their children, but you might also be looking to increase women's participation in household decision-making. So you need to be thinking about how gender intersects with the outcomes that you're looking for and might also influence program attendance, retention, and experience and benefits. You also want to think about assessing the added value of the program adaptations that you've made, and we'll talk a little bit about this later on. But you want to understand whether the modifications you've made not only might be contributing to some new outcomes, but might also be improving the outcomes that you already saw from the previous iteration of your program. And it might also be that the changes you've made are enhancing program retention and attendance as well. And when designing your monitoring and evaluation, you want to think about ways that you can benefit from multidisciplinary expertise and experience. It might be the first time that you're really exploring the impacts of your program on violence or thinking about gender. And so you might want to reach out to organizations and researchers and practitioners who have that experience to benefit from their guidance and expertise. Next slide, please. And within the brief, you'll find a large section devoted to monitoring. And as I mentioned earlier, it really does take on additional importance in the early phase of implementing your newly adapted program. And so you really want to invest in monitoring and allow sufficient time to be able to incorporate that learning to support high quality implementation. And as you're doing that, you want to remember that you can build on the existing monitoring tools and systems that you had in your program before you integrated gender and violence prevention. There's a lot that you can do to strengthen those tools, to modify them, to collect additional information that you need, but you also may need to develop some new tools to be able to complement those. And you really want to be thinking about what questions you have about your program's impact and implementation. What's the data that you need to answer those questions? And of course, that data needs to be easy to collect, analyze, and interpret. You want to be able to design tools that can provide you with data that's on time, clear, and actionable so that you can course correct and make modifications to your program as you're implementing, rather than waiting to the end of implementation to find out that, for example, the changes you made to engage fathers in the program actually weren't working and fathers didn't show up to your program. And you want to remember that monitoring and evaluation are closely linked. They take place at different times, they have different purposes and different uses, but they are very much interlinked. And monitoring has a crucial role to play in helping to understand the context of program implementation, which is critical for understanding the program impacts that you see, or perhaps the impacts that you do not see because of potentially poor implementation. Next slide, please. And within the guidance, you'll find that we've outlined 8 key domains that you might want to consider monitoring. And each domain comes with specific examples and suggested questions that you could use to help you design your monitoring tools. So you can look through those domains and see which ones might be relevant to your program. It might be all 8, it might be only a few. And then based on the key questions that you have, think about what data you need to answer those questions and which tools you might want to adapt or develop to be able to gather that data. And one of the first domains is to consider the reach and quality of staff and facilitator training and support. So you want to collect data on the staff and others that you're training to facilitate, supervise, or support program implementation. You want to be understanding who you've trained, and you also want to understand whether the training is equipping them with the necessary skills, knowledge, and confidence and efficacy to implement or supervise the program. And of course, you want that data to be disaggregated by sex or gender identity to understand whether male or female staff or facilitators benefit from the training equally. But you also want to be thinking about other characteristics that you might want to be looking at. Perhaps you've trained different types of service providers to implement your program, and you want to be able to understand whether those service providers are benefiting from the training equally or engage in different ways in program implementation. The second domain that we highlight, and you can find much more information within the guidance, so I really do hope that you will check it out after the webinar. The second domain is around program impact on staff, facilitators, and supervisors. So you want to assess the impact of the involvement in the program on staff, facilitators, and supervisors' own attitudes about gender roles, about violence against women and violence against children, but also their own behaviors. And you also want to be thinking about ways that you can monitor the well-being of staff, facilitators, and supervisors. We know that implementing these types of programs can take an emotional toll on those who are involved. It can contribute to burnout, stress, vicarious trauma, and so you want to be monitoring whether or not that is occurring within your program so that you're able to provide those involved with the right supports. But of course, we also know that these programs can really provide a sense of personal fulfillment for those who are involved in facilitating and implementing them. It can lead to a sense of personal purpose, of greater self-esteem, of improved social relations with individuals at work and in the community. And so you want to also be documenting and understanding what those positive benefits of the program involvement are. Next slide, please. And the third domain that we highlight is around program reach, attendance, and retention. So you want to be collecting data on how many parents and caregivers and children your program is reaching. You want to know how often they attend and whether they drop out of the program. And we really hope that you can collect data that is linked to individuals and basic demographic information about those individuals so you can understand which individuals are attending and which individuals may not be, and which are dropping out. For example, it might be the first time that you're engaging, as I mentioned earlier, fathers and male caregivers. So you want to know if your program is reaching both male and female caregivers, and what is their retention rate and whether they drop out. You want to understand those differences. And you might also want to be looking at other types of characteristics of parents and caregivers who participate. For example, those with disabilities or parents of children with disabilities. You might want to be thinking about whether first-time parents are, participating in the program differently, or, geographic characteristics, other things that you want to think about, making sure that your monitoring tools are able to collect that data so you can understand really who the program is reaching, how often they're attending, and whether they drop out. And that can really help you to be able to modify the program to make changes. And having that data early on, rather than waiting till the end of implementation, is really critical. So you might find, for example, that in a particular area, parents are less likely to attend and they're dropping out of the program. So you might be able to gather feedback from facilitators and those parents and caregivers to understand what changes you might be able to make to the timing of the session, the frequency of the sessions, or some of the key messages around recruitment to bring them back to the program. The fourth domain that we highlight is around program implementation, quality, and fidelity. So it's really important to collect data that assesses this implementation quality and fidelity to the program's core components and principles. So you want to know whether the program is being implemented as intended, so what is being implemented, the content and activities, but also how it's being implemented. And there's different ways that you can do this to really understand whether or not facilitators are able to deliver the program as you designed it. Are they able to provide that messaging around gender and violence prevention? Are they able to role model equitable behaviors with their co-facilitators? You really want to be able to understand whether or not implementation is happening as intended. And this data is really critical later on for understanding also your evaluation findings, being able to put those into context, because perhaps there wasn't a very high quality implementation, or perhaps facilitators were finding it hard to implement those more tricky, sensitive sessions around violence prevention. So they actually just skipped those sessions, or skipped over the key messaging from those activities. So you really want to understand to be able to course correct, but also later on put your findings into context. And domain 5 is around program acceptability and resonance. You want to monitor whether your program is accepted by and resonates with participants, but also with facilitators and key stakeholders. You want to understand how they perceive the program, including any potential negative perceptions of the program. It might be, for example, that caregivers who participate in your program really respect the program and really enjoy it. But in the community, there's some misperceptions around the program that might be contributing to backlash in the community. So you want to be able to monitor that and be able to address any risks that you're finding. Next slide, please. The 6th domain is around referral to additional services or support. So we know that in your program, you might have women or children who are experiencing violence and want to be referred to additional services or require other types of support. And so you really want to be tracking whether or not that referral is happening and to monitor whether the referral pathways are working as intended. So in brief 3, where we detailed the step-by-step process of integrating gender and violence prevention into your program, there is a section around developing these referral pathways. So making sure that you know which services are available in the community that you can refer participants to, but also how to create pathways that are effective so that facilitators know how to refer participants and that those pathways are working as intended. So it's really critical to be able to track that and to make adjustments where things are not working well. Domain 7 is around mandatory reporting obligations and their impacts. So in some settings, we know that there are mandatory reporting obligations when you know that a child has been exposed to violence. But we also know that that can sometimes lead to negative outcomes for children and their caregivers. So we want to be tracking whether or not those reports are happening, whether they're being made to local authorities, and also, where feasible, follow up to understand whether or not there were any negative consequences to participating families due to that mandatory reporting obligation. And the last domain is around potential risks and unintended consequences. You want to be tracking these both for participants and for facilitators. So we know that when you're challenging unequal gender norms and talking about sensitive topics like violence, there is a potential for risks for both participants and facilitators. And you want to be developing mitigation strategies, as we outline in brief 3, to avoid and respond to those potential risks. And so it's critical that you're tracking those in your program monitoring, collecting feedback from facilitators, but also participants to see whether or not the program is leading to any of these potential risks or consequences, like increasing violence, reinforcing inequitable norms and gender stereotypes, or creating backlash. Next slide, please. And then in the guidance, you'll find a large section devoted to evaluation. And impact evaluation is obviously crucial to understand whether the adaptations you've made to integrate gender and violence prevention are actually leading to improvements in the lives of caregivers, children, and families. Are they leading to the reductions in violence against women and children that you sought? Is it leading to improved, gender, couple, and family relationships? And here, as I mentioned, we're focusing in on research-based evaluation. So a more rigorous evaluation that's sort of a standalone evaluation of your program that is often led by or in collaboration with an external research partner. And it's really best to conduct this type of evaluation once you're confident that your adapted program is being implemented as intended. You don't want to do this in an initial stage where you're maybe still working out how to make some modifications to the program. And we know that it can also be costly, so you want to do it when you have the necessary resources to do so. And when designing your impact evaluation, you want to remember to use your theory of change to select which outcomes to measure. You want to be thinking about what are the key changes and attitudes and behaviors that your program is targeting, and measure those. You don't want to simply measure things because another program did it or because you find it in this guidance, but you really want to be led by what is the content and aims and goals of your program and the theory of change that you have of how the program would contribute to changes in these particular outcomes. And in addition to quantitative, evaluation, whether that is a pre and post, a quasi-experimental, or a more rigorous randomized controlled trial, we really highly recommend that you explore mechanisms of change through qualitative research. So qualitative research with program participants and facilitators can really help you to understand how the program is achieving the changes that it is. And perhaps if you're not seeing the changes that you thought, the qualitative research can also help you to understand why that is. It also can help you to really understand participants' experiences of the program, what they liked best about the program, what are some of the recommendations that they have for how the program can be improved. So qualitative research is really a crucial part of evaluation to understand the context and to help you continuously improve your program. And of course, if you're going to be doing research on violence against women and/or violence against children, you want to follow ethical guidelines when doing so. And we're going to hear more from one of our panelists later on some of the key considerations around that. And within the guidance, you can find a lot of details on what that means and some of the resources that you can rely on when designing your evaluation. And also to inform you, whether if you are not able to actually meet these ethical standards, then it's not suggested to measure violence against women or children. And lastly, of course, you want to carefully select, train, and support your data collectors. They need to understand the tools that they're administering, why they're there. They need to know how to be able to refer participants to services, how to handle participants who might be in distress. And you also want to make sure that you're supporting data collectors. They might feel, emotional toll from collecting data on violence against women and violence against children, and they might experience vicarious trauma. So you want to have the right resources and supports in place to ensure that the data collection is safe and ethical for both participants and facilitators or data collectors. Next slide, please. And within the guidance, you'll find that we have a number of potential outcomes that we recommend you might want to consider measuring based on your program context and also content. So it includes these key outcomes, and particularly in the annexes, you will find recommended measures and tools that you might want to use. So we do recommend, where feasible and possible and where they exist, to use international standardized measures, particularly around violence against women and violence against children, so that we're able to generate comparable data across programs and in different contexts. But of course, you always need to consider how those might need to be contextualized to your program and to the context in which you're implementing it. But some of those potential outcomes to measure include attitudes about gender roles and violence. So, caregivers' attitudes about gender roles with regard to parenting, household tasks, decision-making, and other gender roles, and attitudes about the acceptability of violence against women, about violence against children, and how those change as a result of program participation. And you might want to evaluate and understand the impact on violence against children, particularly caregivers' use of violence against children. And here you would want to ask both male and female caregivers about their perpetration of violence against children. And depending on your program and age of children and the ethics behind it, you might want to collect this information also directly from children. And again, of course, following standard international ethical guidelines. Similarly, you might want to measure impact on intimate partner violence. Here, we strongly recommend measuring women's experience of intimate partner violence, but you might also consider measuring men's perpetration of violence in particular contexts, and of course, following ethical guidelines. Another potential outcome to measure are changes around improvements in couple relations. So here you might want to look at whether the program is contributing to greater couple communication, improved couple relationships, greater empathy and warmth in that relationship, more support between partners, as well as improved co-parenting relations. So whether or not parents feel like they're parenting together as a team. You'd also want to think about measuring changes in couple gender and power dynamics. So looking at changes in whether there are improvements in women's participation in household decision-making, more equal sharing of household tasks. You might also want to look at shared risk factors for violence against children and violence against women, including couple conflict, economic stress, alcohol abuse, and mental health. These can complement measures of violence against children and intimate partner violence, but where you're not able to actually measure those outcomes, you can also use risk factors as an intermediate outcome to understand whether your program might be contributing to changes in violence through addressing these shared risk factors. And lastly, you'll want to think about measuring potential risks and unintended consequences. So thinking about whether or not your program is potentially leading to increases in violence or reinforcing inequitable gender norms and attitudes, but also looking at changes, whether the program might be having an unintended impact on women's agency and autonomy, particularly by engaging men in caregiving and potentially giving them a greater role in decisions in women's lives. So you want to be thinking about what those potential risks you identified of your program are and ways that you can measure them in your evaluation. Next slide, please. And lastly, you want to think about assessing the added value of the program. So you want to continue evaluating the key outcomes you measured prior to integrating gender and violence prevention into your program. So this, for most parenting programs, this includes parenting practices, parenting-child relationships, and age-appropriate child development outcomes. So if you were previously implementing your program and had evaluated these outcomes, you want to keep doing so and using the same tools you previously used so that you can have comparable data on these outcomes from before the program was adapted and after. And this can help assess whether or not the changes that you've made to integrate gender and violence prevention might actually be enhancing some of those outcomes. It can be through, reducing intimate partner violence. The program might actually be improving parent-child relationships and co-parenting practices. By promoting couple communication and improved couple relations, it might be that parents are better able to adopt and sustain positive parenting practices. So having this data will really help to understand the added value of the changes you made to your program, but can also help us to build the evidence base so we better understand how parenting programs that are designed to promote gender equality and prevent violence, whether they have this added value that can help us to advocate for more programs really intentionally integrating gender and violence prevention. Next slide, please. Okay, and before I wrap up, I just want to acknowledge all the individuals who contributed to the development of these briefs, from the authors, from the reviewers, and funders. And I see some of the reviewers are on the webinar today, so thank you for joining and thanks for your inputs. Next slide, please. And I know my colleague Toby has shared in the chat a link to the fourth resource, How to Measure Change, which is out now in English, but it is coming very soon in Arabic, French, and Spanish. And you can find briefs 1, 2, and 3 online in English, French, and Spanish as well, and coming soon in Arabic. And we'd love to hear how you use the guidance. Get in touch with us and let us know if it's helpful. And we'd really love to hear that feedback from all of you. Next slide, please. And now it's my pleasure to turn over to my colleague Moa Schafer with UNICEF Innocenti, who is going to lead the next part of our webinar, which is a panel discussion with parenting practitioners. And I hear that someone has their microphone off, maybe in the background. Thank you. Great. Thanks, Moa. Over to you.
Thank you so much, Kate, for sharing such a comprehensive overview of what's inside the M&E guidance. And it's a pleasure to be moderating the Perspectives panel today. My name is Moa Schafer, and I support the work on ending violence at UNICEF Innocenti. And next, we will hear from our second set of speakers. And I'd like to introduce Melissa Wong Oviedo from Equimundo. Caroline Biaquaso from Makerere University, Giselle Umutoniwase from RAMREC, and Dr. Mia Batia from Oxford University. And in this exciting panel that we have today, we're going to hear from several experienced practitioners and researchers who are supporting the monitoring and evaluation and the generation of evidence on learning on parenting programs that prevent violence and promote gender equality across the globe. And I'm going to be starting off with Melissa with a question. So Equimundo has been working with partners in Colombia to develop and test a digital parenting program for fathers. Can you tell us a little bit about the program and how you've been monitoring implementation, and what has the monitoring data taught you that you wouldn't have known otherwise?
Thank you, Moa. Yeah, absolutely. So over the past 4 years at Equimundo, we've been working with local partners in Colombia to first adapt our fatherhood program, Program P, to the context of Bogota, and then to transform this experience into something that would require less in-person sessions, given that one of the main challenges that we often face when trying to recruit men is enrolling them and sustaining their participation, and high in-person demand in a program is usually a barrier to all of these. So we entered this phase with intention of testing a hybrid program, thinking that a digital component would be able to take up some of the content that we would lose by taking out some of the in-person sessions, but also that the digital component could actually help motivate retention rates among men and families. And we ended up creating a 10-week experience that included only 6 in-person sessions, which we know it's a lot less because usually our programs are around 12 to 15 in-person sessions. So we were very hopeful that this would work, especially because we had done formative research and we had also done 4 rounds of iterative testing and prototyping of the digital engagement strategy. And we even created a branding material and also communications materials to support the recruitment of men. Sorry, I think Caroline's mic is on. Okay, so but when we came to the implementation, we saw that recruitment was still being a challenge. So first, our partners were telling us that there were issues, but that they had ideas on how to solve this. Then after the second month, they continued to face issues. And this is when we decided to check the monitoring data and all of the forms that facilitators should have been filling out during the recruitment process. However, when we checked those, we realized that facilitators weren't actually filling out the forms. And it was really just reinforcing to them the importance of documenting everything that was going on so that we could identify the issues that were being faced. When it came to the third month, with updated monitoring data, we were able to recreate a path from the moment that we were communicating to families and institutions about the program, to presenting it to them, to then having assistance rates on the session 1. And throughout this whole process, we were able to identify different issues and weaknesses, perhaps, in the processes and possible ways to overcome the barriers and the challenges that we were facing at the institutional level. So asking the institutions to motivate the service providers a little bit more so that service provider can communicate better the program at the service provider level, so that the service providers felt more confident advocating for the program and also making the case with the families that this is important. And also at the family level, what could we improve at this session 0 that to make it more engaging, to get more buy-in from families and to help them see the relevance of the program in their lives, and especially for fathers, because we were seeing there were some assistance from mothers, but again, fathers were not showing up. We implemented all of these strategies over a couple more months, but we were still facing issues. And in session 1, assistance rates were not as high as we would have wanted them to be. And what we actually were able to do with our monitoring data is channel through a conversion rate from reaching families. What is that percentage that then actually comes to session 1? And we found that it was very low. It was around 10%. So after many conversations with our local partner in Colombia, we had to decide, do we continue on this route? Do we continue using our resources and our limited time pursuing this process that we know is not working? Or do we cause change? And we decided to do that. We decided to offer a 100% digital program to the families. And luckily, or surprisingly to us, in only 3 weeks, we were able to recruit 180 men and their families, which was just amazing. So a couple of lessons learned from this experience. It's really important to ensure that local partners have the capacity and the time to complete the monitoring forms from the beginning and not retroactively. And that we also take time for us to be able to analyze the data and be able to make changes based on the data that's coming through in the forms. We also shouldn't take for granted that programs will work. I think we often invest so much time designing and making sure everything is absolutely perfect and aligned with a theory of change. But once implementation happens, there's always going to be things that may come up when we're working with the families. So let's take a curious and a problem-solving mindset, especially when we're innovating. And finally, I think just a recommendation is to be brave, because it's often hard to accept when things are not working. We invest so much time and effort in something, but we also have to recognize when things simply just do not go as planned. And it may be scary to pursue something unknown, but it's often worth doing it instead of forcing something that you know is not working. So that was our experience. Thanks, Moa.
Thank you so much, Melissa, for those lessons learned, and like you were saying, being brave and knowing when to pivot. That's all super interesting and really helpful. I'm now going to be passing it on to Caroline. In Uganda, you've been working with partners to implement and scale up the Parenting for Respectability program. And I was wondering if you could share with us your experience of evaluating this program, what outcomes you've been measuring, and the different research methods that you have used over time.
Thank you so much, Moa, and everyone. We have been implementing, we developed the Parenting for Respectability program, which is homegrown here to address violence against children and violence against women. The parenting program addresses 4 main risk factors. That is poor parental bonding and attachment, harsh parenting, poor gender socialization, and poor spousal relationships. It is a manualized program delivered by local facilitators and has a strong focus on involving fathers. So because of that focus, it is structured to be delivered in a session, men receiving the session separately, halfway the program, and also women receiving the sessions separately, halfway the program, and then midway they join together. So the Parenting for Respectability has undergone all the program development and evaluation development processes. And currently, we are doing the scale-up evaluation. So we started this program. This work has been ongoing for the last 14 years. We started by the formative evaluation, which helped us to learn about acceptability of the program, the right dosage of the program, because we started by delivering 20 sessions and now we narrowed down to 16 sessions. For this kind of evaluation, because it is formative, we had a small sample size of about 40 participants. And so we used majorly qualitative means of investigation. So here we are trying to understand the acceptability, the cultural context, and the dosage. After that, we then moved for the before and after evaluation. During the before and after evaluation, we introduced a pattern on board. Why? Because initial findings already indicated that people were very interested in the program and partners around were already starting to implement it. So we had to quickly bring a partner on board, an NGO, so that we can also study with them what would they need to be able to implement such a program. Our sample size then was 600 parents, and we also had interviews with the children. So the parents were receiving the program, but we did interviews with the children to be able to compare and validate the reports from the parents. Interestingly, after the formative evaluation, we already published a paper on men's engagement, that is in 2017. And this is a paper that very many partners and researchers have used to inform their work around further involvement in a parenting program that addresses social norms. So for the evaluation, the before and after, we used both qualitative to be able to study things around attitude, behavior, norms, and values. And we also used the quantitative to understand attendance, to understand retention of both men and women. So after the before and after evaluation, we moved on to do the hybrid randomized control trial, where we combined both implementation science and then the actual research. For this, we had around 2,360 parents, and we also had interviews with half of their children. So we did this work in clusters and in 2 regions to try and compare implementation fidelity, attendance, but also understand issues around scale. Because at that point, we had more partners on board trying to scale up the program. After the randomized control trial, we are pleased to report that we are now going through adaptation of the Parenting for Respectability. We have developed a course for practitioners from this work because we realize that many people in the field of parenting, since parenting is new, they implement programs that are not informed by evidence. But what is evidence? What does it mean to collect data while you're implementing an intervention like a parenting intervention? So we developed a parenting course that is delivered at the university. We have also developed Parenting for Respectability with a strong focus on ECD. We have also adapted the Parenting for Respectability to address concerns of parents with children with disability, but also children with disability. And we are scaling and adapting the intervention to fit into the government structures and systems while collaborating with the Ministry of Gender. And we are happy for such a resource that we are receiving today in this webinar, because we believe that the course participants, because they're practitioners, they're going to benefit from this resource. Some of the lessons that are learned, we have so many publications that are coming from this work, and I want to encourage you. You just put in Godfrey CU, and you're able to see the different publications that have come from our work over the years, so that you can inform the development, the implementation, and the research around families, focusing on the risk factors that we are also trying to address. So thank you so much, and I am happy to be here. Thank you so much.
Thank you so much,
Caroline.
Thank you so much for sharing those insights. And I believe the paper has also been just shared in the chat as well. So we encourage you to take a look at that as well. Giselle, RAMREC is working with the Rwandan government to scale up the Banderejo program, which works with couples to prevent violence against women and children through the health system. Can you share with us the types of outcomes that you've measured when evaluating this program, and why you measured these, and what has changed as the program has scaled up?
Thank you, Moa. And I feel there's a lot of shared experiences with Caroline and Melissa. And just for context, Banderejo program was also adapted from Program P, which Melissa has mentioned, for the Rwandan context back in 2013. And now, more than 10 years later, we are in the scale-up phase as well, where we are scaling in 3 districts across the country. We, in collaboration with the government of Rwanda, specifically the Ministry of Health, through its implementing arm of Rwanda Biomedical Center. So Banderejo throughout the years has obviously gone through a lot of different evolutions, both with program delivery and with evaluation and monitoring. How we've approached evaluation of the program has also changed during the different phases of the program. During the pilot phase, we conducted our first randomized control trial We collected data from about 1,200 couples, roughly equally split amongst the control group and the treatment group. At the time, it was in 4 districts of Rwanda where the program was piloted. And then we collected data from the same participants, both at baseline, and then 9 months later, and then 20 months later. And at the time, we were looking at a number of different outcomes that included, for instance, women's experience of intimate partner violence, men's participation in household tasks and child care, the use of physical punishment and other forms of violence with children, men's dominance of household decision-making, and the range of other different factors, as well as, of course, parents' mental health, parents, and other child development outcomes. And it made sense at the time to use this, type of evaluation, do some rigorous research, because while we had refined the curriculum and adapted the program to make sure that it's context fit, we needed to make sure that we can prove and that we have solid evidence that the program is actually working to address some of the challenges that we sought to address at the time. And so the findings and having this gold standard type of evaluation were able to give us the proof that we needed to try and move to the scale-up phase. And at the time, then the question that remained after conducting that rigorous evaluation was, now that we know the program works and now that we know it's addressing or delivering on the main outcomes that were intended at the beginning, are we able to sustain these outcomes over a longer period of time? And so we conducted a 6 years post follow-up study to look at whether or not we're able to sustain those outcomes. The post follow-up study showed that those main outcomes were not only sustained, but some of them there's been improvement in some of those outcomes, including, again, on reduction of violence, intimate partner violence, and couple communication, and violence against children, and other main outcomes. And so now that we had gone from the pilot phase and showed the program does work, it's addressing the main issues that we wanted to address, and we've proven that the program can sustain, that the program outcomes can be sustained over a longer period of time. I feel it's given us really a solid vantage point to try and get buy-in and obtain buy-in from the government of Rwanda, going back to your question more on how do we work with them and how did we get there, because obviously the government of Rwanda and many of our stakeholders, including as well donors, are very keen on designing and implementing evidence-driven programs, gender transformative programs, and we were able to prove that not only is this program able to reduce significantly incidents of intimate partner violence and violence against children and other main outcomes that both the government and RAMWEC and other stakeholders were interested in, but we can also sustain this for a longer period of time. And so one of the shift that we're seeing now in the evaluation process during the scale-up phase is that our priorities have shifted. We are still very much interested in, of course, evaluating most of those main outcomes, particularly looking at drivers of change that we were able to identify at the time of conducting the RCT. But mostly we're also interested, as Caroline also mentioned this, at looking at the quality and fidelity of the program. So when the program was first piloted, it was delivered by the staff, as is, they usually done. But with the process or the plans of scaling up the program, one of the main changes that was done for program delivery was to have the program delivered by the community health workers, which is a community health workforce, as I'm sure you're aware. That I know that it's a community structure that's very common in Africa and other parts of the world. And so we were interested, not just us, but also, again, to have a strong case for support and to continue generating momentum from donors and government. We need to be able to prove that we're still able to deliver the program at scale, but without compromising on its quality. And so some of what we're doing now, some of the evaluation work that we're doing now is that we are still tracking some of the main indicators drivers of change that prove the program is still able to lead to reduced violence against women and children, and other main indicators and outcomes. But we're also doing qualitative research with community health workers to evaluate things like their capacity to deliver the program and confidence to deliver the program with quality and fidelity, and also to try and understand other areas of potential strengthening of the program. And so maybe one of the main questions now is, how do we use all this data to continue improving the program, and what uses the data to us? I think one of the main ways in which evaluation of VAW has been really helpful to making it a successful program is that obviously the data has helped us, again, to get the buy-in from the government. We are now at a phase where, for instance, some of the program indicators have been integrated in the National Health Management Information System, which is the national system used for the community health in Rwanda through the RBC. We have also gained other forms of support, both financial support and just more ownership from the government, that now leads us to believe that the integration of the program within existing government interventions is possible and can be achieved in the near future. But it has also helped us gain support from funders. We know that in the field, obviously, a lot of funders have keen interest in supporting programs that are able to demonstrate this impact. And a lot of the community-driven interventions do have the impact, but oftentimes don't have either ways to document and generate evidence on that impact, or opportunities to showcase that impact. And so being able to invest really in this area has helped us to showcase the impacts of VAW and get more donor support. And it's been sort of a positive vicious cycle almost, where we get more donors that are interested, and so also interested in funding more research. And so we can have more research that helps, again, to continue getting more support. So at the moment, we are as well looking at things like cost effectiveness, again, to really try and prove that this is a program that, if taken up by the government, can lead to sustainable transformative change for families and couples and children in Rwanda, but in a way at a reasonable cost that the government can sustain. So I think that's what I can share from VAW and our experience. We've learned quite a bit. There's a lot of challenges, of course, including cost of doing rigorous research like RCT, which again has also taught us to prioritize at different phases of the program. Do we need to do an RCT right now, or rather do more routine monitoring and focus on that, and conduct as well some maybe qualitative research and focus more on that at the moment? And then obviously we plan to continue doing more research in the future as the program progresses. And happy to share as well some of the research in the chat on VAW, the previous RCTs, and new learnings as well. And thank you. Back to you, Mo.
Thank you so much, Giselle. It's really interesting to see how the outcome measurements have evolved over time as the program has grown. And now I'd like to pass it on to Amia. Your work has included both qualitative and quantitative research on violence. And I was wondering if you could share with us some of the ethical considerations that organizations should be aware of when monitoring and evaluating parenting programs that address violence against children and violence against women.
Thanks, Moa, and thanks also to my wonderful panelists. It's truly a pleasure to share this space and this conversation with you. So I think we can all agree, and I think most of us probably feel very passionately, that ethics and ethical considerations are absolutely integral for M&E, in program design, for impact evaluation, and for research. And I think we've all heard this phrase that ethics is about to do no harm. And I think what I want to put into the space is the question that actually, how do we make ethics be about more than just do no harm? How do we think about ethics in the context of M&E as a question of justice, as a question of equity, and as a question of inclusion? And how do we be in conversation with each other as we design these programs and do this work where perhaps we could say that ethics is about whether children and caregivers feel included, whether communities feel heard, whether our team members who are delivering these interventions, who are collecting these data, feel safe, are not traumatized. And how can we position ethics as central to not only keeping each other, children, families safe, but also being about building the long-term relationships with communities, with households, with health workers that are just absolutely crucial to delivering parenting programs. So that's sort of the first thing I want to say, just to locate ethics and to put it on the map in this way. The second thing I want to say is that often we see Excel spreadsheets, Word documents, and the outputs of M&E systems. And actually, what is that? We see it as data, but that is actually the lived experience of children and of caregivers and of the many people involved in delivering these programs and running M&E systems. And what we receive are people's lived experiences as data. So a commitment to grappling with ethical considerations is a commitment to thinking about how we want to collect and hold carefully these lived experiences. And central to that then is having the care to say, if I'm creating a situation where a child or adult may disclose violence, or if I'm asking a child or an adult directly about violence, how can our teams prepare for the answer? And I think that is really one of the biggest challenges that all of us face as we do our work. And so I want to kind of move to the last bit of my comments, which is, given that's the challenge, how do we meet that challenge? And so just a couple of quick thoughts here before I pass back to Moa. So first, there are some excellent resources on ethics in the M&E guidance. This comes from WHO, from UNICEF, from CDC, on how to design M&E, on how to do interviews, how to make them safe. And so if you are in the process of having these hard conversations about how to embed ethics throughout the process in your organizations and in your M&E systems, please have a look at those. I think sometimes it can feel hard to have these conversations, and it's really important to remember that we stand on the shoulders of colleagues, of experts, of advocates who've been doing this work for many years. So I really want to draw attention to that guidance. Over the last few years, with Raising Voices, with AfriChild, with UNICEF Innocenti, with Childline Zimbabwe, we have been trying to write down and think through some of the challenges and ethical considerations we have faced in our work on violence against children. And so we have put together something that we call REFER, which is 5 pillars that we could all think about before we design M&E systems, intervention, and research. So I'm just going to briefly share those so that perhaps some of them are useful or interesting, or you have other pillars that you use that you want to pop into the chat and share with us. So the first thing that came out of these conversations between all of these organizations from the Global North and Global South was the importance of a resource response plan. So how can you sit together with all of the colleagues involved and plan the response? When a child or an adult discloses violence, when they're asked about violence, what happens next? What funding is needed to ensure that? Who needs to do what, and can that be written down? The second pillar is to engage context-specific expertise. This work needs to be done in partnership and collaboration, and very few of us and very few of our organizations actually have the full picture or the complete expertise to do safe and ethical referrals and response planning. So who needs to be involved? How can we center and privilege local knowledge? How can we center and privilege the very institutions that understand, and I mean deeply understand, the children and communities being served by these interventions? And if, for example, the intervention is about children with disabilities, which local institutions and activists need to be involved? And this is also important because grappling with ethical considerations requires hard decisions. So thinking about who needs to be involved and how these decisions will be made is a really important piece of planning. The other three pillars that we are suggesting are to follow the best interests of the child. So how do you train implementers, researchers, data collectors to listen to and think through what the best interests of the child are? The fourth pillar is to establish support for the very researchers and implementers doing this work. How can you offer them the training, the resources to prevent vicarious trauma? We offer our teams counseling and access to support for their own well-being. And the last pillar we suggest is just the importance of reporting and reflecting on all of these efforts that we're all making in our work so we can learn from each other. This is a growing, iterative, moving piece of work, and it's really important that we have a community of practice around us. And just to close, I want to say that sometimes thinking through these ethical considerations, figuring out how to make an interview safe, an interview private, how to give researchers the training that they need, means that you have to pivot. And I think our first panelist really shared that well with us. So I want to close by coming back to this, because actually sometimes staring the ethical challenges in the face means you need to do something else. It doesn't mean all is lost, but it does mean a pivot is required. So if research, M&E can't be done safely, if you can't guarantee referral processes, can you change your tools? Can you tweak your questions? Perhaps you could ask about norms or attitudes, or whether people have information about services instead of asking directly about violence. And sometimes thinking through all these ethical considerations serves to affirm, support, and uplift the approach that you and your team have come up with. And I think the challenge and the puzzle is to be open to both and to create processes for designing M&E tools, M&E frameworks, and impact evaluations that have these ethical considerations embedded right at the beginning and traveling alongside you throughout the way. Thanks, Ma. Let me pass back to you.
Thank you so much, Amia, and thank you so much to all of our panelists, both for your time and for sharing all these insights and reflections from all of the important work that you're doing. I'll now be passing it on to Lina for the next section of our webinar. Lina, over to you.
Thanks, Moa, and thanks everyone for such an enriching session. I'm super excited. I'm even worried about talking too much and spoiling what you've just had. There's been so much rich information coming out there, from the good infographic we've seen from UNICEF to the paper that was launched, but more even importantly, seeing the good work already happening on the ground, with people already having good insights on how to monitor, measure, and even do our work ethically. I'm quite impressed with the fact that some of the programs have already been evaluated 6 years later, and even finding that some results are continuing to go down, and just showing the importance of designing, implementing our programs and getting time to evaluate and learn from them. So now I want to open up for questions. We have a few minutes for questions, and we've gotten many questions, some of it which we'll be able to answer now. Just because of time, we might be able to put out a Q&A and answer sheet later alongside the material that we send with this webinar. So if your question is not answered, just look out for this with the link that we'll send. So the first question, I think this I'll send to Caroline or Giselle. The first question comes from Hatran, where it asks that, can you elaborate on the indicators that you use to monitor implementation, quality, and fidelity? So maybe just take a few minutes to just give us a few, 1 or 2 indicators that you use to measure your quality of your programs and implementation. Both your programs have been adapted and taken to scale. You can start with Carol and then Giselle.
Thank you so much, Dr. Lina, for that question. For the parenting for respectability, while we're doing the randomized control trial, as I mentioned initially, that the program addresses 4 main risk factors. That was poor parenting and attachment, harsh parenting, poor gender socialization, and poor spousal relationships. So the tools that we use, or the measures, look at those 4 main risk factors. So the tools are addressed to respond to those. And as a result, when you ask me an indicator, I want to report that for child maltreatment, we had 49% reduction as reported by the parents after a 6-month follow-up for our evaluation. And for the spousal relationships, indicators around intimate partner violence, PFR parents reported 51% less IPV perpetration and 53% less IPV victimization. And all this was after the 6 months follow-up. So these are some of the indicators and the results that we saw were very powerful, that made it possible or necessary for us to take the parenting for respectability to scale.
Thank you, Carol.
Over to you, Dr. Lina.
Thank you so much, Carol.
Thank you, Lina. Yeah, just briefly, some of the things were mentioned earlier, like dosage and frequency and other things. We don't go far from what is recommended. Some of the indicators we're looking at include, of course, if we have, of course, a structured curriculum that we use for during Vandeverejo's group education sessions, which is how the couples / parents come together and learn about the different topics that are delivered during the Vandeverejo trainings. And so we're looking at, are the community health workers able to deliver the curriculum as designed? Are they following the session frequency as it was designed, or are they starting with, say, topic A and following topic X instead of topic B? We also look at, of course, things like, the duration of the session. We use some of the tools that we use include observation tools to look at, how the trainers are delivering the content of the curriculum. And one of the key aspects of that monitoring for us includes having what we call supervisors that are really in the supervisory and technical support / coaching role. And these are health facility staff that are there to, again, use the observation tools and other different monitoring tools and make sure that the community health workers are delivering the program as intended, or at least be able to log and provide feedback, which is then feedback that the program team will use to see if there's need for adaptation, for more capacity building of community health workers and things like that. So we're also looking, of course, at program principles, is the core principles. We pride ourselves on being able to deliver the program in a way that's participatory. So is that something that's coming through when the training is delivered by community health workers as well? Are we giving gender equitable messaging? How are the group dynamics and so on and so forth? So we have a range of indicators that we look at, but those are some of the main ones that help us figure out whether or not we are still as closely aligned to the intended way of delivering the program as we should be.
Thank you, Ghazal and Carol. I'll take the next question. This one is open to any panelist who may have a response. A number of your recommendations, both for monitoring and evaluation, assume one operates in a well-funded system. How do you suggest we adapt these domains when implementing in a low resource setting? Could you look at developing a graded M&E scale, costing different components, and recommending what to prioritize with available budget? So I think the domains are the ones that get presented. How do we prioritize these domains or indicators in a resource-limited setting? Kate, I don't want to put you on the spot, but you want to go first, and then maybe we can hear from one person who's had this implementation experience.
Sure. I think one of the things that we try and highlight in the guidance is that it doesn't mean you have to do all 8 domains. But one of the things that we also try and reference in the guidance is it doesn't mean each domain requires a separate tool. You might only need 2 tools to gather all of the different domains that we're talking about. And I think like the Bandabarejo program that Giselle was just talking about is an example of a program that has been collecting monitoring data across those 8 domains. And including as the program is now scaling up through the health system and trying to make the program as cost effective as possible to be able to sustain that implementation. So I do think it takes a lot of work and a lot of effort, but it is possible to do with limited budget. The guidance is very much driven by the experience of those of us involved and partners sharing their experience of what they are doing and what's working. So it is influenced and hopefully brings to light the actual experiences of programs that have been doing this in under-resourced settings and with limited budgets.
Thank you so much, Kate. That's well said. I don't know if anyone has something brief to add before I move to the session.
Okay, yeah, it's okay. It's okay.
Panelist? Okay. So I'm going to stop.
Hi, Lina. Dr. Lina, just to add in a resource, a country like Uganda that has challenges around resource, parenting interventions have a benefit because they are delivered to parents in groups. So this means that the cost that you would have used to deliver a parenting intervention to one parent can actually reach out to 20 or 25 or 30 parents in one group. And also use of local facilitators. It means that if the local facilitator, a peer parent, is given sufficient training, this person can actually deliver the training in a participatory manner, considering the context of the norms around the community to deliver a high quality parenting intervention at almost no cost. And you can actually tap into the local government structures and give them the tools. For example, for the parenting for respectability, we use the facilitator assessment tool. And these tools are given to the community development officers and the parish chiefs to be the ones to monitor the implementation and the delivery of parental sessions at community level. So this way, you can see that the intervention that would either be costful, it is being delivered within the resources that are the community, bringing in their own venue, their own spaces, their own refreshments, and while maintaining the fidelity of the program. Thank you. Over to you, Dr. Lina.
Thank you, Carol, and thank you everyone for your insights and your great experiences. We're really excited to see how this will move forward. Please, I encourage everyone to read the paper, but also speakers and panelists who presented on such good experiences and programs. Please put your link so that people can find more information there. And please reach out to us in event that you have a burning question that you have wanted us to answer and we didn't. I'm going to now hand over to Victor Nyland, who's the director at UNICEF Innocenti, Global Office of Research and Foresight, to give us closing remarks for this session. Welcome, Bo.
Well, thank you, Lina, and thank you to everyone who has been contributing. I really found the conversations very insightful, and as a former child protection practitioner, I'm also really excited to hear that we have this new tool and to be part of the launch today to really seek to enhance monitoring and evaluation of these programs that help prevent violence before they happen. And so by strengthening parenting programming, we can really find a shared commitment to addressing not just child well-being, but also gender equality and family safety. I wanted to emphasize a couple of things, and then I wanted to also afterwards give perhaps 3 points in terms of some of the thinking on the way forward and how to maximize the use of this guidance. But before I do that, just to say that in this period of change and where we've seen also that the resources for any typology or program in development and humanitarian assistants are scarce and we're being asked to really look for efficiencies. This type of intervention with one single intervention where we can simultaneously promote gender equality and reduce violence against children and violence against women, this is really something that we must take to heart and celebrate. And so the resource on monitoring and evaluation plays a key part in bringing the evidence together on the way forward for this important typology of programming as we work together in partnership. And the second reflection was really to thank you all in terms of this collaboration and partnership, and in particular the Prevention Collaborative, Equimundo, but also, of course, my own colleagues here at UNICEF Innocenti, as well as in the UNICEF Child Protection Team. And all of you who have joined online today, I see so many active participants, and it's really great to see the interest in this tool and interest in doing a better job on this type of programming. So let me move to my 3 quick points before we wrap up. And I think the first one is building on Carolyn's important interventions, and it's about how do we make sure that these programs are integrated into systems and that we're able to take them to scale and have really sustainable impact. And so this way of working together with government, finding ways of always thinking through, okay, how can I get beyond, let's say, a limited scale initiative to something that I can have partnerships that allow me to do them for many more families and children to be benefiting. And so this is something really important to build upon. And the more lessons we can have about impact and scale and how we make use of systems, the better we can also make value for money and continue the efficiency gains as we develop these programs. So that would have been my first follow-up point for all of you to think about as you implement. The second one is in the area of reaching the hardest to reach. And here I'm thinking in particular of both conflict affected as well as climate affected areas and disasters, and how we make sure even where the family is under stress, family separation, and so forth, how we can take into account the needs of children and the preventive mechanisms responding to harmful gender norms and preventing violence, both within families and beyond. And so this is another challenging area and situations that we have many of. And looking at how we apply these tools to some of the, let's say, most difficult of situations and the hardest to reach children. And then my final point, I've spent quite a bit of time lately looking at the whole question of how children are influenced by radicalized ideologies. And here, what we see is that boys and young men growing up without positive role models and not having guidance and resources that they need in order to grow into adults who can nurture a healthy and respectful and equitable relationship within the family and beyond. This is something that is a huge problem in society in all typology of country, because as we all know, child protection dimensions are not particular to any particular grouping in terms of low income, middle income, or high income countries. And so finding ways here also to address questions around masculinity and how to really support young boys and young men to grow up with stability in life and with sense of meaning that doesn't lead to risk behavior is something that we really need to look into, how to provide a positive masculinity and to really work to prevent toxic masculinity. So these would have been my 3 points. Again, really looking to embrace together in these partnerships the power of evidence and collaboration, and the proactive and preventive actions that we're taking together. So thank you, and Lina, back to you.
Thank you so much, Bo, for that powerful closing. We have had a good discussion this session. I can see the chats. Really, people are excited about what they've had. I want to remind you that you can access the resource that was launched today in any of the 3 websites, UNICEF, Prevention Collaborative, Equimundo, and you can get other resources linked to some of the programs that you've had here. People have sent the link, use those. Stay connected with us through the links that you'll see at the end of the site, and we look forward to hearing more about what you're doing with this resource. Thank you so much for coming. Until the next one. Bye.
Bye-bye.